You can climb down. So next we go to Dr. Sanjeev Jadia, and his talk is titled on the story of how I performed cataract. Now this is interesting. The story of how I performed market cataract in a lion's eye. First ever phaco on Asiatic land. I'm sure it is. Please carry on, sir. Your time still not running. Starts now.
Thank you, judges and panelists, for giving me an opportunity. This is the story how I operate the lion's eye. This is the wild animal. This is in Sasan, in Junagadh, in Gujarat. It is the last and first home Asiatic lion. I'm going fast slide. How the problem discovers. The trackers of the forest department, this is not a human, it is a wild animal. The problem starts, trackers know the lion was following abnormal behaviors in one of the range of forest. Only responding to light, frequently head injury, sitting at one place. There are so many things. He is not hunting even. So he called me to examine the patient. They caught at the rescue center, and we go there 100 kilometers from the Junagadh, far distance. We there examine that lion on torchlight. On torchlight we saw that bilateral mature cataract was done. In a rescue center, in a large case also, he is not even taking his meal. He was by smelling, he go to the meal. Only smell he goes, and head injury is also due to that. Okay, he followed the urine of the pet animals and he broke the pet animals cages, and hunting only pet animals, not wild animals. This is the how we examine in the smaller cage. That now the challenge is what to do now. After the permission of the forest department, I told him, transfer him to nearest zoo where hospitals are available in Junagadh city. We examine at night time. We started our examination. After 1 month, everything was in mind. What to do now? After 1 month of first detection, we started examining at night. From gun tranquilizer, we tranquilized that patient. A-scan did, pachymeter, keratometry, all did. Although we are in dilemma, meantime, these are the photographs that we did that time. Meanwhile, one accident in train accident where lion came into postmortem. I dissected that. This is the lens last dissected position. I saw a keratometry in dissected eye also. These are the preoperative A scans. AC depth was 10, lens thickness is almost 8 millimeter. The keratometry of our machine is not 35, less than 35 is not possible. So we concluded this way, and other on the photographs of the other, so we conclude around 30-31 keratometry was there. Lens thickness is 5 to 6 millimeter, ACD is 10 millimeter, Pachy is 1000 micron. It is 1 millimeter thick cornea. White to white is 24 millimeters. It is large, and a pupil size is also more than 6 millimeter. Usually these are nocturnal animals. They move at night. Asiatic lions are. The night pupil was mostly more than 6 millimeters, 6 to 8 millimeters. We now challenges are how to use calculate the IOL power. We contacted then Warren Hills, Professor of Ophthalmology, Visual Science, Arizona, USA. He guided us Resolve formula and ELP, expected lens position. And we all, after all diameters, we calculate this. This is the response from Dr. Warren Hill. These are the formulas, all are in meter. Formulas are in meters, and our is in micron and millimeter. So we calculated this. Our machines also calculated like this 19, or lastly all we concluded 21 or 21.5 will put that IOL. Overall size is 24 millimeters. Optic diameters is 8 to 10 millimeters. Now we are searching who is manufacturing. We tried so many manufacturers, biotech, Envision Germany we contacted. That time Corona was there. So he did not respond. He told that okay, we'll make this, but not possible this time. He gave us the trying to give us the lenses of horse, but it is not fitted and not possible. The size is not matching this way. Orolab Care Group. Finally, Orolab made this veterinary IOL this size, 24 millimeter, 9 millimeter optics. Hydrophobic IOLs they made. Now the challenge is IOL is there, or everything is there. How to operate? This is the animal. He is not lying like us, but he is lying sideways, not exactly. So we did microscope, Carl Zeiss microscope, and make a stand in zoo separately, and start all devices are made for that only. It is not possible. This is the stand. This short video is there. How we make this stand. This is the OT table. Few days ago, we started how we operate, how we plan our cataract surgery for this patient. He's 5 years old, 160 kg. His life is around 18 to 20. He's 5 years old. That's why bilateral cataract is there. Totally blind, wild animal. The forest department has tried. They will do operate. This way we operated. IV line was taken. Tranquilizers was given. These are the preparation, pre-operating, all OT and all this. We did phaco abbot ellipse. This is the speculum, but not possible. There is nictitating membrane that is disturbing us, and the eyeball going down and down. Without speculum, I started the surgery. Few of our instrument, few of other instrument we taken. Some of the videos are from outside, some of them from the microscopes. These are the spy side ports. After tranquilizer, the eyeball is very soft. Refined blue dye injected, mature cataract, I did CCC. Capsule also very thick. Pigmentation. Okay, I'll just finish. This is the CCC. I complete. Now the IOL I put in the bag. The overall time is more than 1 hour, 1:30. We planned bilateral at the time, but it took 1.5 hours for first. So we planned 10 days later, and we did bilateral surgeries. Thank you.
Anything, Subhashish sir? I think you have a microphone there, just behind.
Hey, chalu kari thoda first.
This is a really great job that you have done, and I personally feel privileged to see this in your video. I don't know whether we'll ever see in lifetime. I don't know.
Thank you.
You have operated hundreds.
Unless you consider me a lion and coming to get operated by you.
Yeah. So well, I don't know anything else. We have got no experience.
I am very much
we
blessed
must
to have
congratulate you.
serve Asiatic line.
Yeah.
Thank you.
I
This
would
is
just
the
like
in
to.
the bag IOL, first POD, third POD. Within 3 days, it is very much clear.
No anti-chamber
One,
reaction. nothing.
no, nothing. One suture, 10 o'clock, 10 or 0, I took one. Holder and folder are also, Epsilon gave us special for design for this. Everything is specially.
Yeah, I was just about to ask you that because the optic size is so large. So how did you fold it in? So folder. And
especially from Epsilon, they gave us.
But I'm just interested to know what preoperative aseptic protocol did you take, because I saw that the eye was pretty exposed, and I think I saw your bare hand, so you're not even gowned, if I'm not wrong.
No, that is the only examination.
Okay.
Then we start.
After that, you scrubbed.
That is what to prepare. Then we start.
Okay.
We don't know what is the possibilities are there.
Okay.
Then we'll start. OT, Basilol and everything, and pre-operative, all betadine was and everything was done. With gloves we did surgery. But speculum not possible. One veterinary doctors, he hold his lid and I'll operating that. But very shallow AC and 10 millimeter is ACD. There are so many times air bubbling are there. 25 cc OVD was took for one surgery.
Yeah, I think not even the phaco needle would
it
adjust to the AC.
Largest, longest.
Absolutely. So 10 plus 8 is almost 18 millimeters. So you have to go right to the neck of the handpiece just to ensure that the tip is reaching somewhere close to the posterior plate.
Even
amazing.
Now whole video
Even
is
then,
there.
Even then, the obliquity would be so much that it would create a lot of corneal folds and maybe mar the visibility
very
also.
Soft eye, very fold.
Great. Good. Thank you.
Thank you. Thank you, sir.